Good morning. I'm Dr. Michael Dixon. I'm chair of the College of Medicine. I'm a GP in Devon and delighted to welcome you all to this crucial conference of the College of Medicine. Um, Thank you for coming. Thank you for showing that commitment, especially on a Saturday. So you must all be highly committed. And thank you to the organisers. And I hope that quite apart from the content today, you'll be able to rub shoulders with each other and find a fellowship with people who have the same values and the same aspirations for their careers and their patients. Because speaking for myself, I regard working in the health service as a real privilege and a vocation. I'm 72, and some people would say I shouldn't be practicing anymore, but I do because I find it so enjoyable and so fulfilling, and I hope that you will as well. At a time when, and I don't need to tell you this, there's too many students and mature clinicians around who aren't enjoying their jobs and their careers, or not finding them as fulfilling as they should. Now, the College of Medicine is a college that looks beyond traditional pills and procedures. But I want to say right away how important the biomedical training that you'll be having and biomedicine itself is to our health and well-being. I wouldn't be alive before you here today if it wasn't for it. It's no secret that the King is currently having some very sophisticated biomedical treatment. And if I look at my own patients, for instance, when I started 40 years ago, most of them would be dead by 65, certainly 70, whereas most of them now live till, well, the late 80s in many cases. So biomedicine has achieved a massive amount in terms of life expectancy in heart disease, cancer, and relieving suffering. But sometimes the danger is it's lost sight of the person who is behind that disease or that part of the body that's not working. And it's that the College of Medicine is really about. It's about looking at the whole person. It's about respecting their choices, their hopes, their beliefs. It's about fitting the medicine to the patient rather than the patient to the medicine, as it were. And social prescribing, which is something that the college has been very keen to champion, is all about that. It's about taking the person where they are and beginning to find solutions that are appropriate to where they are. So for some people, it may be simply about food banks. It may be about getting jobs. It may be about housing, or another stage, it may be about communal activities in the arts or exercise or whatever. But making sure that what we do for our patients is relevant to them, and that we are incorporating them in their health and their healing. And right away, to the importance of lifestyle. The college, for instance, has greatly advocated healthy eating in the sense of everyone being able to and motivated to eat a healthier diet. We know that what we eat is one of the biggest factors in whether we fall ill. And in your work in hospitals, you'll probably see this enormous paradox of wonderful medicines, but the food simply not being part of that healing process. And we need to make what we eat part of making us healthier, and when we're ill, part of making us better as well. Ditto for exercise, which we know is so important, particularly as we age. And relationships, we know that if you don't have close relationships, that is as bad for you as smoking. And what we do is also important. Research at University College London has shown that if you're depressed, you're 3 times more likely to get better from that depression if you take up a hobby. And we need to be looking out of the box, which I hope you all will be. I mean, what we're offering conventionally is not going to help those 25% of 14 to 16-year-old girls who are currently self-harming. It's not going to help that 40% of 11-year-old school children in London who are obese or overweight. We've got to start thinking differently about what we offer and what the health service offers. And we've also got to be a bit more open-minded, I think, about what ports of call we're going to choose, and respectful not only of our different professionals groups, and that's why it's so wonderful that you are a multi-professional collection today, but also we need to be respectful of different healing traditions, whether things like acupuncture or hypnosis or mind-body interventions, because our patients are self-organizing beings. They're not black boxes that we pour our medicines and procedures into and then something comes out. They are part of that healing process, and actually probably the most important in many cases. So thank you for coming to this conference, because you are the future and you need to be part of designing that future, and making it more appropriate, not only for yourselves as agents in health and healing, but also for your patients. And I think the reason why you're here today, the reason why you've come out on a Saturday, is because you are people with strong values and strong commitment and strong motivation. And what I can tell you is that those are the things that will see you through both your training and your development as you enter professional life. Those are the things that also will see and make your patients better. And if we have those things, those values, that commitment, that motivation, that goodwill, that is what will make a sustainable health service for the future. So a lot of responsibility on you today, and I really look forward to hearing about the outcome of the sessions, and welcome you to the college, and you being a force for the future, a force of professionals working together with the same forward view and making the world and the health service a different place. And have a great day.